Well, folks, we continue our week-long series on Medicare as Democrats scramble for ways to finance their $5 trillion spending plans. They've targeted your Medicare with the goal to put price controls on prescription drugs now. Team Biden is promising Medicare should be required to, quote, negotiate drug prices. But really, this is nothing more than a strong-arming tactic to companies to concede to the government to set prices for drugs, or face, of course, a penalty, a tax, as high as 95% on sales. That's not going to be good for the consumer. This pretend negotiation would tie price increases to inflation, which means higher prices for your drugs. Have you looked at inflation under Joe Biden right now? It is soaring. That means drug prices will soar. These artificial price controls will stifle innovation, so new drugs that could save your life may never reach the market. Well, joining me now is former senior official for the U.S. Department of Health and Office of Personnel Management during the Reagan administration. Bob Moffit is here. Also with us, host of Dick Morris Democracy right here on Newsmax and former advisor to Presidents Clinton and Trump, Dick Morris. Bob, Dick, great to see you both.
Good to be with both of you.
Good to be here.
All right, Bob, you first. You know, on the surface, this sounds all well and good. We're going to make them negotiate, and this is going to be great. But really, this is anything but, isn't it?
This is not a private sector negotiation where a couple of people sit across the table and they bargain back and forth about what they should do. No, this is raw coercion. The government is saying you are going to take our price, and if you do not take our price, we're going to impose on your company an enormous tax. This is basically nothing more than an old-fashioned price control regime. And Grant, we have had 4,000 years of experience with price controls. 4,000 years of experience.
Yeah, so that's some negotiation. It's our way or the highway. It's where I'm from in New York. That's called an offer you can't refuse, Dick Morris. You think this is all about total government control, Dick?
Yeah, well, it is. But the interesting thing about it is that the price controls are not for us. They're for the government. The reason they're doing this is to lower the cost of these drugs to Medicare and Medicaid, so the government pays less for them. And then they're going to take those savings and use it to expand Medicare to a point where it probably goes bankrupt. And so they're not trying to save money from us. They're trying to save money from their own pockets. And the other point is that 27% of the budget of the drug companies goes for research and development. We would not have a COVID vaccine right now if there weren't enough money sticking around in drug prices on things like statins and antibiotics, stuff that is no new research, but everybody uses. They pile up revenue there and use it for R&D. There's no government grant for R&D to go find the vaccine. If there were, we still wouldn't have one. But it's private competition, and the reason they're doing it is because they can charge more for the stuff that has already been researched and developed to subsidize the other stuff.
And so, of course, innovation then gets absolutely smashed. So, Bob, what is your biggest fear with this entire plan of theirs? Are we going to even have Medicare come 5, 10 years from now? I don't know, maybe 2 years from now.
Well, what's happening right now is that Medicare is facing really big financial crises. I mean, the Medicare trustees just came out with their report, and they said that Medicare will be insolvent in 2026, which means that it will not be able to pay for all the benefits that have been promised. That's 5 years away. We've got to make a decision about how we're going to deal with this. The other problem is Medicare is generating deficits and debt over time. The long-term obligations of the program right now are over $48 trillion for the next 75 years. That's bigger than the national debt. So we're going to be looking at massive spending, massive tax increases. And with price controls, what it really means is that we'll be paying more, but we are going to have less availability for drugs. There's never been a case where we have imposed a price control or on any good or service where we did not have shortages of those goods or services. And that's true with prescription drugs. The United States is the global leader in drug development. If we kill innovation in the United States, we are going to undermine the quality of life for millions of Americans and other people around the world.
Again, go figure. They throw free markets out the window and go for total government control. Bob Moffit, Dick Morris, both of you, thank you so much for coming on today.
Thanks for watching the Heritage Foundation's YouTube channel. With more than 500,000 members, we are the nation's largest conservative research and education institution. We believe the principles and ideas of the American founding are worth conserving and renewing. Please help us further our mission by subscribing to this channel and sharing our videos with your family and friends.